Thank you, Professor, for this nice presentation. As we have been told by the President of the Congress, Dr. Nasser, we have two more presentations. I have the honor to present Dr. Sergio Gianzini from Italy. He will be presenting first in human electron microscopy identification of lymphatic glycocalyx, and the second presentation would be evidence-based aquatic protocols for vein lymphatic patients.
Thank you so much. So after arteries and veins in Urgada, let's talk about corals, I would say. And that might sound like a strange starting, but in reality, if we look at the surface of the corals, you're going to find something that you can find in both arteries and veins, ciliar structures that are sensitive to the flow deep down in the oceans where life started. This is a nice Britannica video that is indeed talking about mechanotransduction. This happens in arteries, this happens in veins. So on the surface, on the endothelium, we have a receptor that is the glycocalyx. It's a ciliar structure that by bending because of the different flow is transmitting biochemical messages that allow the coral or our arteries or our veins to grow and behave physiologically or pathologically. So bear in mind this halo structure that you can find on the surface of the coral, because at the end of the presentation, up to our knowledge for the first time in human, I will show the same picture we identified this time in the lymphatics. So the glycocalyx, as I said, is a sort of antenna, a receptor. And to remember what it does on the surface of the endothelium, I usually think about the computer. So PC, permeability, regulates the permeability of the endothelium, protection of the endothelium, contractility, and at the same time, coagulation. Balance. So we are talking about PC, permeability, protection, coagulation, contractility. It's been perfectly described by Zhang as a critically signaling platform, a very intricate network of glycosaminoglycans and protoglycans that are involved indeed in the protection of the endothelium as per the paper by Governer. We know the importance of the forest to cover the land. We understand the importance of these ciliar structures to protect the endothelium lining. And indeed, as I said, the glycocalyx has been identified as an innovative treatment target for both arteries and veins. And in honor of Egypt, whenever we are talking about veins, we should talk also about the lymphatics, meaning that Antonio and Cleopatra, veins and lymphatics, a family affair, as it has been described by our beloved Hugo Parsh, whom we always remember him, and B.B. Lee in this nice publication I suggest you to enjoy. So we ask around the world if there is such a thing like a glycocalyx in the veins and in the arteries. Is there also something like that in the lymphatics? We asked all our friends around the world, no answer, so we started this investigation at the University of Ferrara together with Harvard and Stanford University. We deeply thank them for the collaboration from in-human samples, so ex vivo, lower limbs, during fat lifting, veins and the lymphatics of the same subjects sent to the biolab for looking at the electron microscopy identification of an eventual lymphatic glycocalyx. I congratulate Professor Rimondi for having found a way to fix the sample, because this has been extremely challenging. You can imagine how fragile the tissue in these cases is. So once we have fixed it, we have been able to have the first in-human picture up to our knowledge of the lymphatic glycocalyx that you can see over there as a halo structure that really reminds me the halo structure you saw on the surface of the coral. So quite fascinating thinking that inside our vessels we have something similar to what we can find on the beach tomorrow morning on the surface of the corals. So here is like veins and lymphatics of the same subject. So now we have in front of us the possibility of studying the different characteristics of the glycocalyx based on the different flow acting on them. And so we have all the measurements, but I don't want to take too much of your time on this, but of course we took all the macroscopic and microscopic measurements possible. But surely you could tell me, Sergio, you're just showing us a picture, so what are we really looking at in reality? And that's why we ran immunohistochemistry. So you can see over here podoplanin that is confirming the presence of the lymphatic and of the vein, and at the same time the stainings for the typical components of the glycocalyx, that is glypican, for example. But we identified also different components because, of course, there is not just one and it cannot be the same of veins and arteries. So there is also brevican that makes sense because it is usually present in the intersynapses tissue, and mucin that is usually present in the extracellular matrix. There is also agrin. I hope you will not ask me why it's there because we don't know, and that's the part of the research that still keeps us going every day, from bedside in this case to the bench. To go back to the bedside, I would say, because clearly here we are talking about the fact that we have been failed at med school when they were telling us that there is just the Starling law regulating the edema and the filtration. Clearly the composition of lymph is not the same of plasma, so there must be an active filtration through a sieve of various porosity that indeed could be the glycocalyx. So we are talking about phlebolymphedema, but also in the arterial patients, the possibility of managing the edema with a new treatment target. A vital topic that will be included in the meeting we will have together also with many friends from Egypt in Varela Island near Venice, where we are waiting for you. And everybody can submit, if you want, a video presentation and be included in this vital brainstorming. Thank you so much. So you're not tired of me?
You still have three talks. You still have 3 talks.
Well, I'm happy you're not tired of me. So. But this one will be relaxing because this will be about the spa environment. So you know that from ancient Latin, spa, salus per aquam, and we know the benefits of going into the aquatic environment, the seaside, the pools of these nice hotels, and indeed there is so much funding dedicated to this. This is the report of the Global Spa and Wellness Summit. A lot of money, a lot of funds put into the aquatic environment. But in reality, you see Darth Vader over there reminding us that we as Vascular have not produced that much in terms of evidence-based data on how we can use the aquatic environment for our veins and lymphatic and also arterial patients. To the contrary, the colleagues from the rehabilitation ward produced a lot of data. Indeed, we have produced so far basically data on the quality of life, and surely it does not require to be Einstein to understand that if I'm in a spa, my quality of life is better than if I'm in my hospital. So we have all these people going into this aquatic environment and enjoying the pool like these 3 labradoodles, not really understanding what they are doing and where there is the real benefit and if they really need to go hot and cold water, for example. If you go back to the times of the cassettes in the 90s, Ernst already told us that by walking into cold and hot path, we can have an improvement of the edema and of some hemodynamic parameters. But the problem in science is always to deliver standardization and reproducibility. And in that investigation, every patient was doing something different. So there is no standardization, no reproducibility. We go back to the time of the CDs, so we are around 2009, and Carpentier published something very interesting in a crossover study where he showed that indeed going into the aquatic environment rather than outside the aquatic environment means having a benefit in terms of pain control in the lower limb. But again, the problem that every single patient was doing something different in terms of exercise, so no standardization, no reproducibility, no science. The potentials, if you really think about that, are huge, because every single centimeter of water is a 0.7 millimeter of mercury. This means that if I was now standing in a pool with the water up to my navel, I would have 0.7 multiplied 120 centimeter, more or less 80 millimeter mercury, which means 4 pairs of stockings at the same time, not even perceiving that, and we can discuss why we don't perceive that. That's why back in 2017 we started a research line at the University of Ferrara dedicated to the aquatic environment. We standardized the protocol of exercises, we tested on phlebolymphedema patients, we published on Phlebology Journal where you can find the protocol, it is available. Basically we demonstrated that with 2 sessions per week, in 5 sessions total, we were able to significantly decrease the lower limb volume by 300 millimeters, that is of course quite a lot. Subcutaneous tissue and circumferences were significantly decreasing. Michael Jackson is there with a moonwalk to remind us that walking backward is actually activating more the calf pump, so we were using also the backward walking, and indeed the ankle range of motion increased and correlated with the decrease of the edema. At the visual analog scale, there was an improvement in terms of evidence perceived by the patients. There was no difference in functional ambulation classification, that is a classification to see how good I walk. And if you want, we can discuss why maybe there was no improvement in this. But again, you can tell me, Sergio, you are failing us because we don't know if it is the aquatic environment or if it is the exercise that they are doing. So we did a randomized comparative trial, and we put the same standardized exercise inside and outside the aquatic environment. That's the data study that is published on JVS last year, a very serious and large study that included the same protocol, same features, standardization, reproducibility. And what we demonstrated that indeed it is the aquatic environment, because the lower limb volume decreased only in the group that was in the aquatic environment. Subcutaneous tissue decreased in thickness only in the aquatic environment. If we look at the caliber of the GSV, that in my opinion has no value at all, because you should also assess all the other calibers, but the GSV decreased only in the aquatic environment. And Michael Jackson again demonstrates to us that, to the contrary, the ankle range of motion improved in both groups, inside and outside the pool, but more in the aquatic group. Correlation, of course, was only for the group that had a decrease, so the aquatic environment, quality of life improved, interestingly, in both groups with the civic, but with the BVMCQ only in the aquatic environment, which tells us once again the need of taking pictures from different angles when we are using the patient's reported outcome and the quality of life. So in this case, one was improving in both, one just in one. Another publication we put it out was focusing on the bioimpedance analysis to be sure that we were looking at the edema, and indeed there was a decrease in the extracellular fluids in the aquatic environment, and another one that was focusing in the correlation between lower limb volume decrease, extracellular fluids, and, as I was saying, ankle range of motion, so the importance of mobilizing properly our patients. Last publication was about the impact on the cardiovascular system with a better control of the heart rate and a better control of the blood pressure. So I think this interests basically everybody. That's why we also included that in the document that now is coming out in International Angiology as a world group effort, in which Egypt has been strongly present last year during the Expo, for which I invite you to visit the website. And again, I'd like to invite you to join us in a place full of water, that is Albarella Island, where there will be a large discussion also on this topic with a course dedicated to this, so that we can also together promote in the different countries, as we are already doing in many parts of the world, proper advancement. I will take the last minutes just to remind you of this meeting in Italy, because we like to try to do something different. If you think about how much time we spend just giving talks rather than discussion, so we will do it a bit different. You can upload your presentations in a digital library, and they will be discussed with the biggest experts from all around the world. So the time on stage will be mainly for discussion, and we will enjoy all this presentation before. So you are invited to submit whatever topic you consider vital we look at, and whatever literature we should know, and whatever literature we should develop in the future. At the same time, I have the honor of representing the International Union of Phlebology, and I like to declare that the doors are open for whoever wants to be engaged with that as well. Thank you so much.
Thank you, Professor Gianzini. And now we came to the end of this wonderful session and prestigious meeting. Dr. Nasu, do you have time for questions? Or?
No, just 30 seconds.
So we will have 2 minutes of discussion. Does anyone of the co-chairmen have questions?
I think definitely they are exhausted, so I would like